Hey everybody, thanks for joining us. I'm Dr. Kelly Weisner with Flourish Columbus, based out of Indiana, and we are here to talk with you about why we're over it. The benefits of cash-based physical therapy, not only for therapy providers, but also for you as clients. Talking to a lot of people across the country, getting everybody's take on it, and here we go.
Cool, guys. And I am Dr. Jen Morgan. I am based out of Connecticut along the shoreline. Centrality Wellness is my business. And we are here with a really, really cool, rad West Coast doctor of physical therapy, Dr. Alyssa Kuhn. And she's going to give us a quick little background about who she is, her business, and then we'll rock and roll. So, Alyssa, thanks for joining.
Absolutely. So I just recently transplanted out west from the Midwest. So it's been kind of crazy. We are now located in Salt Lake City. So my business is called Keep the Adventure Alive, since there's all sorts of opportunities for adventure out here. What I am pushing is adventure at any age. So a lot of times people think that when they get older, they have to give up everything. They have to just deal with pain. That's just how it works getting older. And that is so not true. And I've already met so many people out here, 60s, 70s, 80s that are still out there biking, that are still out there hiking. And so those are the kind of people that I want to help navigate obstacles. There are obstacles that do come into our way, but we definitely can get around those. And that doesn't mean you just have to give up on what you love. So I'm super excited. I'm pretty new to the cash-based field, but I'm so excited and have already loved my experience so far. And so I'm so happy to be here.
Super cool. And so tell us right off the bat, where were you, what type of setting were you in before you launched into a cash-based model? And what was the final straw of why you decided cash-based was the way to go?
So working with the older population, so I was doing home care. I did home care ever since I graduated, so for a couple years now. And when PDGM, PDPM, all that stuff came about, and then Medicare cuts and things, it just seemed like it was, one cut after the other. I got tired of, people telling me who to treat, how to treat, how often to treat, and there's just so many restrictions and so many guidelines that you have to follow, especially with Medicare. So I definitely got tired of it. And so I am now on my own. And I think that there's definitely opportunity and so much more freedom as far as, treating on your own, making your own rules, that sort of thing. So I just, got tired of the traditional model. And I don't think that, with the patient volume we have to see, with the, reimbursement rates and things, people aren't getting the care that they need.
Yeah.
Totally. That's crazy. And that's great. Oh my God, I have so many questions. Kelly, why don't you start? What is the first question that pops into your mind? I'm sure we have the same one.
So, since you are kind of targeting that older active population, what's your plan for the Medicare patients, the Medicare clients that want to seek out your services?
Yeah. So, obviously Medicare does have some gray area, which we do have to just deal with. But so I'm mainly targeting more of the wellness crowd, which a lot of the people in the Medicare realm are targeting. Essentially, unfortunately, if somebody comes right after a very acute injury or immediately after surgery, typically we have to refer those out. But how I approach it with a lot of people, especially those, that had a really acute injury that's actually limiting daily things, I made a checklist to make sure that, we can go through these to really justify whether it's medically necessary or not. So I kind of walk through that with them. But then what I explain is, okay, you can go to traditional physical therapy that will, reimburse, and insurance will pay for that. Up, the 2-4 weeks, whatever you need to get back. But then if you want to get back to hiking, if you want to get back to, you know, somebody who was talking about playing pickleball, like if you want to get back to those higher level things, PT might discharge you before you do that. So then we can work together on like a strength base, definitely kind of managing your injury or whatever it may be while you're doing these sorts of things. So kind of picking people up after that. But then also, I mean, if they don't have an injury or it's not medically necessary, then we can definitely roll forward with exercise programming, one-on-one, you know, training, that sort of thing. So definitely the gray area makes it kind of hard, but I think people can kind of conceptualize that, you know, traditional PT might get you to, you know, okay, you can do all of these things in your home, you can do very basic things, but they don't always have the time to, you know, get you back to your higher level activities or be able to justify it. So
Totally. And do you ever have to answer the question, you know, if patients or clients are asking for a super bill, so like an itemized receipt, because it's more wellness based, right? So that's not a coverable service.
right.
Have you ever had to kind of distinguish for your clients coverable services versus not, and why you will not need a super bill in this type of model?
So I actually have just paperwork that we kind of talk about that right off the bat. So because obviously with Medicare people, you have to get kind of the agreement that they're not going to try to go for reimbursement. And like I said, I mean, it sounds kind of, you know, confusing. A lot of people just don't understand, like, why do I need to do this? Why is Medicare, you know, so restrictive? And so it is kind of, you know, definitely something to address right off the bat. So I actually, in my introductory paperwork, I have them sign an agreement saying you can't submit this to Medicare. This is why it's not medically necessary and that sort of thing. Because again, if it is, I do recommend they go see someone, you know, especially for the first couple of weeks. And then we kind of pick them up at the end. But people usually don't ask, especially after we, you know, kind of talk about that initially. So.
Cool.
Nice.
Yeah. So
do you have those patients that are clients that don't have Medicare that see you for physical therapy and then transition more into kind of a wellness program, or is it pretty much just the Medicare client looking for that extra?
A little bit of both. So I am just starting out. So, you know, the few patients that I've had, typically it is more of just a wellness type thing. I haven't seen too many people yet just for like the physical therapy side of things. And I mean, quite honestly, they kind of mesh together. So Keep the Adventure Alive is physical therapy and performance. And so, I mean, you could justify it as physical therapy, but it could also just be performance. I mean, these people are just wanting to, you know, get back to these higher level activities, get back to, you know, getting out on the trail or whatever it may be. So it's a really gray line. So I kind of I try not to put a label on it like, oh, you're getting physical therapy services, you're getting performance services. Because honestly, at first I tried to differentiate the two, especially the Medicare route and things. But then I was making the flyer and I was like, well, I mean, it's really hard to kind of justify the two. So I just made one general and, you know, I don't necessarily differentiate the two.
totally. And
Love that.
let's talk about like your marketing, right? So you mentioned in your like brief intro that you just did some like rebranding and you're new to Salt Lake and all that fun stuff. Are you marketing to like CrossFit gyms, you know, biking stores, those types of things? Because you are also a CrossFitter and an active biker too, correct?
Yes. So I just recently went through a rebrand. So I was Move Well, Age Well prior to moving out here. And then just being here and, you know, seeing, like actually going out on like hikes and things, because coming from the Midwest, I mean, we didn't do that very often. So actually like going out and doing these things, that's what kind of inspired the Keep the Adventure Alive, just because you see all sorts of different people and you definitely don't, I wouldn't want to have to give that up because of pain and things like that. So that's kind of what inspired that. So that has been very, very new. So within the past, you know, week and a half-ish, I have transitioned to Keep the Adventure Alive. So I have really been trying to push the rebrand online first. And then now I'm working towards pushing it both in Utah. So since I've been in Utah about a week, I've just been doing crazy networking, like 4 to 5 calls a day of just, people that are in the area, because I feel like moving to a new place is very challenging, especially on the networking side of things, just because I feel like I really don't know anyone. So I have just been using this, first week or two to figure out where to go, to figure out, what places might be more receptive. Because I know sometimes, your marketing materials just get lost and, you send email after email and no response. So I'm really trying to kind of at first narrow down maybe 2 or 3, 4 maybe warmer leads for places. And then my goal is to do a free seminar, 30 minutes, an hour, just on either like how to move well and age well, how to keep, the adventure alive, something like that, just to briefly describe the services. Because after I've talked to a couple of people, and I've unfortunately heard, from like 1 or 2 that like, oh, I've tried physical therapy in the past. And this is just from like networking, not necessarily prospective patients, but like, oh, I've tried physical therapy in the past. And so we have a lot of stereotypes to kind of push through. There are a lot of cash-based physical therapists out here, mainly like in the Pilates, yoga, athlete kind of realm. So it definitely is growing. And I think that that is going to help kind of push through those stereotypes. But especially I feel like for older people, they aren't necessarily aware of the services that are available, especially with cash-based PT versus just like a traditional run-of-the-mill. Where like our age, I mean, we're more well known about, the cash-based services available. So that's it's mainly just kind of pushing out education of what we do and what we can do, the more personalized services, all that stuff. So I'm really trying to kind of narrow down those places first, and then kind of go from there. So not yet, but I will be.
Nice. So you mentioned that there are quite a few cash-based practices out there. Does it seem like a lot of people you talk to, whether it's leads or just people in the community, they kind of have heard of cash-based PT and are familiar with it, or not so much? Or what are your thoughts?
I would lean more on the edge of not so much. And that could be the group of people that I've been talking to. I've mainly been talking to just other business owners. So I would say on the realm of not so much. But again, I mean, that could be just the people I was talking to. So I think definitely education is so important for marketing, because I mean, if people, aren't aware of, they just think that, if you need PT, you just have to go to a big hospital system, or you have to go to, somewhere like that, versus these more niche places. So that's why definitely I think education is needed, especially in a little bit of an older population.
Totally. And I saw that on the information you sent us originally that you have a Facebook group, and that's not something that many people have. And is that open to people who are like curious about what you do, or is that open to people who have like already been working with you and more of a community for people who work just with you? Like, how is that structured?
So it's for anyone. And that's kind of, I use it to, continue to push education and all that stuff, but it's for people that are all over. There's very few that I think are just central to Utah, but the goal of that group is to just be a support system, just kind of get the ideas and things out there that, pain and weakness aren't normal signs of aging, and really try to get some advocates for it. So I think it's grown to a little over, I think we're at like 230-ish something members. And it's great because they can give me input as far as, what sorts of education they want, what sorts of insights they need, almost like a small focus group. So that way, you're not creating content people don't want, or you're not creating things, wasting your time with things that you think people want, but they don't actually want. So for anyone starting out, I would highly, highly, highly recommend creating a Facebook group. It's so easy. Because then you have kind of a built-in focus group, because when I was in Columbus, I mean, I was trying to reach out to people here, but I wasn't obviously here. And so I used that group to kind of get things rolling, get some ideas and things to use once I got here. So yeah, it's open to anyone. It's called Keep the Adventure Alive Community. So yeah, I mean, any age group. I have lots of people that are in that older 40, 50, 60, 70 group. I also have clinicians. So any, PTs, OTs, PTAs, personal trainers who are looking for exercise ideas for their, older patients and things. So it's been kind of interesting. But yeah, I mean, it's been really helpful for the focus group side of things. But then also, making sure you're pushing out valuable content.
Mm-hmm.
Cool.
Yeah.
Nice. Do you feel like your target clientele, they're pretty technology savvy where you are out in Salt Lake?
I would say so. I mean, the people that I've come into contact with so far, I mean, unfortunately, everything's pretty much been on Zoom anyways.
Yeah.
But I also feel that, everything is so accessible nowadays. I mean, just a couple of clicks and you're on Zoom or, FaceTime. So I think it's definitely, been pretty easy. And even if people have never done Zoom or something like that, I mean, I think it is a very easy platform to kind of walk people through.
Mm-hmm.
So it seems that, especially one of the good things I think that came from all of this COVID stuff is that virtual is more mainstream. So, I mean, we can use those virtual services to, I mean, I'm in Salt Lake, so I'm not going to be driving like all the way, if someone 4 hours away is still in Utah, I mean, so virtual can, help with that. So, I mean, it can really help expand your reach. I just think one of the hard parts is the buy-in. Especially in that older crowd. A lot of people still want face-to-face, kind of disregarding this whole situation. But so I think that the buy-in, especially like cold leads, going right to telehealth might not be the easiest, but I do think it is becoming more mainstream. And the longer, this stuff kind of goes on, I think the more mainstream it's going to be. So I think it's going to be much more easily accessible.
Totally.
Yeah.
How do you generate buy-in? So I know that you mentioned that you're new to Salt Lake, but like in Ohio, what are the ways, or what do you think like educational nuggets are to kind of get your clientele to be on board?
Yeah. So a lot of times what I do, I also do exercise programming. And so, which has been my primary source of revenue at the moment, as far as patients are concerned, is showing people, personalized workouts and things, especially when people were at home, making it more of a rehab based, but it doesn't seem like rehab kind of thing. So I think the buy-in definitely, what I typically do is I just give a sample. So I typically do just week-long programming, but I'll send like 2 or 3 days so people can actually try it out and see before making, the commitment. And I think as far as like PT services and things like that go, just, hopping on a call with someone just like this and talking about, their goals, what they want, and have them actually visualize kind of what that's going to look like in the future after, we've had a few sessions together and things like that. So definitely kind of just giving a sample of what you do. And that's one of the reasons why I'm like constantly pushing YouTube videos, constantly pushing all sorts of content. So that kind of helps that process forward and kind of speeds it up a little bit. And then, going forward, turning into potential clients.
Cool.
I like that.
I am not on YouTube. And before you got on this call, I was talking to Kelly and I was like, I'm not on TikTok. I'm not on YouTube. I'm like, do I need to be doing these things? Like, do you find that YouTube is really beneficial for like what like your messaging is and your branding and like your outreach?
I do. I 100% do. So I encourage YouTube 100%. I'm not on TikTok either. So I'm trying to prioritize a few things out at once first. The good thing about YouTube though, and I always try to tell people that, you're creating all of this content for Instagram. Instagram likes videos. So you're already creating these videos. And so what I typically do is doing an exercise series, like a knee pain exercise series, 5 days of exercises you can do. You already have those videos. So then I mesh them together and create a YouTube video. The good thing about YouTube is, I've also gotten into a couple of different Facebook groups, like a knee and hip replacement group, and a couple other, fitness over 60, that sort of thing. And so the good thing about that, especially that knee and hip replacement group, is so I made a couple of videos because I just scroll through and see what people are asking. And then I made a couple of videos to answer some of the common questions. And so all I have to do then is pull the link and just put it in the comments. And people, like this morning, I did one on hip stiffness because someone was asking about it in that group, and then that's going to help drive traffic to it. Eventually I do want to go more primarily online education and things like that. So building up a YouTube following, I think, is going to help with that too. It's just a lot more easily accessible. I have a lot of people on my Facebook group that follow the YouTube channel and to the workouts and things. So I do think that it's beneficial, especially if you want to kind of expand your reach a little bit. And half the time you're already making the content. So it's very easy just to put it into an app, mesh it together, and then upload it to YouTube.
I like that. I've heard that before. It's like you're already doing it. Why not?
Exactly. I mean, that's really what I do for the most part. Some of them I just make for YouTube, but for most of you just mesh the things together, and I mean,
there you go.
Video goes a long way. So yeah.
That's actually really, that's really smart. I'm sitting here like, oh my God, I have so many, my phone, like my entire phone content is like, you're too full. And I'm like, yeah, I know. Cause I have like a zillion different videos of things that I want to share. Right.
Yeah. You got to get Dropbox. I've been using Dropbox, and Dropbox actually has a video editing software right in it.
Oh,
so it's called Clipchamp. So you don't even need to, because typically if something's in Dropbox or Google Drive, you have to export it. Right. And then have it in your phone and then edit it and then either import it again or whatever you're going to do, but it saves that step. So definitely something, and it's a pretty good editing software from what I found. So definitely worth looking into. There's tons of stuff out there, but yeah, because I was running into the same issue. You have all of these videos that it's like, you don't want to delete them because, you don't know when you're going to need them again or whatever. So just putting them into a holding spot definitely helps.
Totally. So, okay. I think one of the biggest things that pops up for me is timing, and what I mean by that is, you are not restricted visit count wise. Like, people can follow you and see you for as long as they see the benefit, correct?
Correct.
That is that's huge. Like, that is such a huge benefit that they get to pick your brain on every chance that they need to, right? So if they see you once a week, is it kind of like a once a week thing for your clients?
It depends. I mean, if they, want more, my ultimate goal is, if you need more intense, like if you maybe have a race coming up, or something like that, or even just, a flare up in knee pain or whatever. It could be, 2 times a week, whatever. But the ultimate goal would be to kind of go through those 2 or 3 weeks of more intense, maybe it's 2 times a week. And then kind of progressing more to maybe a once a week or just a virtual check-in like this. And then kind of move into maybe once a month, that sort of thing. So there's definitely options, and depending, like if someone responds better to in person and maybe they aren't super technologically savvy, then maybe it does need to be in person. But I think a lot of the times it could be once you establish, that relationship and that exercise program, and that they are able to do the things that you gave, then I mean, just a virtual hop on a quick, 15 minutes would suffice. But I mean, obviously, like anything, it depends. So, but yeah, I mean, I just think that there are a lot of options. So you're not just stuck to the 2 times a week for 4 weeks, reeval, and it's like, so.
Yeah. So do a lot of your clients, once they kind of get comfortable with the programming, then do you continue to provide them with programming? Do you do like packages for certain periods of time? Does it kind of, how do you design that longer term exercise programming?
So the exercise programming is 4 weeks at a time. So I do a week at a time for 4 weeks. And then, I mean, you can renew it for as long as you want to.
Yeah.
I have someone that's going on, I think their second month. I think it's been a couple of renewal cycles anyways. But then some people that just want, one, and then we do virtual follow-ups, that sort of thing. So it could be short-term, it could be long-term. It just kind of depends on what. I had a few people that were just looking for things to do at home during all of this, and then now they're going back to their gym. So it definitely gives a lot of flexibility. So as far as, exercise programming, that is 4 weeks at a time. But the PT sessions are offered in 4, 6, and 8 visits to be used in 60 days. So, I mean, with savings, the more you buy. So that's kind of how I'm running that, but yeah.
So are you limited to just Utah? So you are a physical therapist providing PT treatment for some, but you are also a physical therapist providing wellness-based care for others. And so for the wellness-based individual, if they're like, oh, I want to work with Dr. Alyssa, but I live in Chicago, like, is that possible? Or are you restricted by your licensed state?
I think so. It's again kind of gray, unfortunately, which is hard because, personal trainers have no state lines.
Right.
We go to school for longer most of the time, and we are restricted. I just feel like it is such a gray area. I've heard kind of 2 different things, or hearing, so many different things about you can go across state lines, you can't go across state lines. So obviously physical therapy, and this is, again, when it gets kind of gray between determining whether it's performance or, actual physical therapy. To me, I think physical therapy falls into the lines of you had an injury or something and we're, working on that. Typically, a lot of things I think could be swung the wellness route, whether it's, dealing with chronic osteoarthritis or something like that. Yes, you could say that it's physical therapy, but you could also say it's wellness. So it gets to be kind of tough. The exercise programming, I'm not limited, from what I've heard, you're not limited. Don't quote me on that. But I have a couple of clients in Michigan right now. I am still licensed in Ohio though too. So I have, I think, 1 client in Ohio right now. So it depends on who you talk to, honestly, from what I've found. Some people say yes, some people say no. But I try to keep, very clear records, have them sign, this is not physical therapy. You are not receiving physical therapy. And so then, under my understanding, I think that we should be able to do that. So again, it just kind of depends on who you talk to. But for right now, I just have clear documentation, and then, just kind of go from there. Definitely showing people, because if people think like you're going to a physical therapist, then, oh, I'm getting physical therapy, but definitely making that known that, okay, this is not physical therapy. This is just, exercise programming or whatever. Mainly just the exercise programming, I think I'll go out of state. A lot of the physical therapy and just like wellness type things, I think I'll keep in my licensed areas. But just the remote programming, to me, I don't see the issue. But again, it just depends on who you talk to, I guess. It's so hard and it's so frustrating, to have to
Yeah.
jump through all these hoops and stuff. And when other professionals don't have to do that, I don't know. It's frustrating.
Yeah.
But I just think,
Yeah, it is hard. And I think, you see so many, I follow so many people who I think are amazing, and they have created content, whether it be free, like ebook, or they actually have paid programs that you can walk yourself through, fitness or whatever it may be. They live in like Australia, or they live in like New York, and like, that people are doing it, right? So
right. And so I think with that though, that is totally fine.
yeah.
So that is one of the things that I'm trying to kind of infiltrate, is pushing out just a lot of general things that people can buy and then consume. Because I think when you get into the personalized route, that's when it gets kind of dicey. But, producing a course or producing just a general programming, which I think personally for programming, that's kind of hard to do. But, I just did a recent nutrition course called Eat Well, Move Well, Age Well with a registered dietitian on how food choices and things and exercise can help, manage inflammation and can help do all that stuff. And so we've had people all over the country for that. So pushing general stuff like that, definitely with disclaimers and things, but that is totally fine. It's just the personalized aspect of it, I think, is where it gets a little gray.
So much gray.
Everything is so gray. It's so frustrating, because then, one person will tell you, oh no, that's totally fine, whatever. And then you hear someone else say, oh, well, I don't know. So it's very hard to just get like a clear answer. I mean, so
Yeah.
but then you see other people doing it too. And it's like, well, I mean, I don't know. So I don't know, but yeah.
That's super cool. So honestly, I think from what I'm hearing, like, you are probably the first person that we've talked to that is taking PT outside of like we're going to call it a traditional cash-based model. Like, we've seen people who they're cash, but they're providing therapy services, right? So it's not, we're not really having the conversation, the dialogue about like, what is it like to leave the states that you're licensed in? Or what is it like to create this awesome programming that you can, give for free, or you can actually charge for, and it can be, it's kind of limitless. Like, it's just something that's different that you still can do with your beautiful PT brain, right?
Yes.
And so it's just super cool.
I mean, there are so many options. My goal is to create a membership site where someone pays, a subscription, and have, different tiers of things, but, to create an exercise library and to make these things more accessible and push out more of this general content, just so you're not so restricted to, your state or wherever you're licensed. So that's kind of my ultimate goal. Eventually, I do want to be primarily online, and, kind of minimize the direct patient care. I mean, it just goes with the whole, trading time for money type thing. I mean, you can only do so much. And so in order to kind of scale, we have to kind of look at other options. And so I've been working a ton on that, researching membership sites, figuring out, will people like tapping into, are you paying for a concierge physician? If you are, what type of services are you getting? Are you, pleased with that? And then, kind of seeing, okay, well, how can this transfer over to therapy? I mean, because again, we can only see, a certain number of patients a week. I mean, even if you're like maxed. So, I mean, that kind of limits, especially when being on your own. Because are you guys both on your, like, just you?
I have a business partner, but it's just the two of us.
Okay.
Yeah, it's just me. But because it is just me, like, I also entertain those ideas of like, what does it look like to be online? What does it look like to do a course? What does it look like? Because Kelly and I are both pelvic health PTs, so it's, pelvic health, there's so much information that we can bundle and do. It's just,
and I feel like that's with, like anything too. I mean, there's so much out there, and it's just doing the figuring out what people actually want. But I mean,
Yes.
I do think like courses and things are so, the opportunity is so great, especially now, that people are realizing all of this stuff is online.
Yeah.
And I mean, going back to what we were talking about just a second ago, I mean, since we are so restricted with state licensure, I mean, yeah, pretty much, they're pretty much restricted, but, I mean, to expand your reach and to kind of grow your audience in, a global standpoint versus just, into your state. So it's been interesting kind of looking at some of these things and seeing what other people are doing. Not necessarily all in the PT, but seeing what other people are offering, to kind of see how we could fit into that as well.
I'm just curious, do you have any PT that is a membership based model that, like, off the top of your head?
So I found there was one, I cannot remember where he was, or quite frankly, the name of him, but which is very helpful. But they're very limited. First off, I just, Google search physical therapy and membership, that sort of thing. But one of them offers, again, kind of like in person, like you pay, it's almost like a concierge physician. You, get a certain number of visits a month and, that sort of thing. I haven't necessarily found anyone that is doing like a scalable membership, meaning, not just trading, again, time for money and, seeing people in person. So, that is a little bit, but there are like health and wellness professionals, a lot of the yoga and things they offer like a virtual class or a certain number of virtual classes, and then, push out like a webinar a month or something like that.
Mm-hmm.
So there are other people doing it. There's just not a ton of physical therapists doing it.
Yeah. No, that's true. I mean, the only thing I can think of, Kelly, I don't know what you can think of, but like Tracy Scher, she's pelvic guru on Instagram. She has a membership site, but it's for clinicians. Like it's for clinicians and other pelvic health providers. It's not for like the consumer.
Okay.
I've seen a few of those where it's more PTs are pushing it out to other clinicians, but yeah, I don't know that I've really seen any physical therapy driven membership sites for consumers. I mean, what an awesome thing. But because the health and fitness industry is doing a lot of that, but I don't think really from a PT background standpoint, there's much of that out there yet.
Right. I know that the prehab guys, I don't know if you've heard of them.
Yeah.
I know they do some sort of membership, and they do more kind of just purchasing courses from what it seems like. So I don't think that they're limited necessarily in their state. So I've been kind of looking at kind of that model to see if we can kind of integrate that. Like they have an awesome exercise library. And I think doing that, for me, targeting older people and targeting, the outdoorsy type and things like that. So I definitely think there's opportunity. It's just kind of figuring out what you can include to, that what people want and what people will be willing to, pay, I don't know, 10, 20, 30 bucks a month. Based on that. So I definitely think there's opportunity. It's just going to be, finding what better serves people, which is why I'm going to start doing direct patient care, at least for probably the first year or two, just so I can kind of figure out what people want, what common people I'm seeing, that sort of thing.
Yeah. I love that. I think that's awesome. I love it. So cool.
I know, it's different. As I said, everything you're doing is like super cool, super different. Like you're using your brain for good, which I love. Like you're really practicing at the top of your license, and you're like catapulting what a physical therapist could do. You're shaking those bounds, which hell yeah, like I'm all about it.
Well, yes. I mean, and I just think, especially for the aging population. I mean, I talk to people about this all the time, and I just think that there's such a gap in higher level performance things with older people. I mean, once you turn 60, you are doing pink dumbbells and seated exercises, when that's really not what what it has to look like. And so with the nutrition course, we kind of started experimenting with this a little bit, because it's essentially like how to increase fat loss with age, how to best add muscle with age, and how to, manage inflammation and that sort of stuff. But definitely more for those active, people who are trying to, continue doing all of these things. So you're not just kind of grouped into the, I don't know, typical senior exercise that you see. I mean, there's a lot of people that are, 70, 80 that are way stronger, are still out there doing things. And so I think it does take away a lot from that, just the traditional healthcare. Or, I mean, if you see someone that's 70 that walks in, I mean, you're like, okay, we're going to start doing shoulder press here. Try these 2 pounds first. And it's like, I don't know. So, it's definitely kind of pushing those stereotypes and kind of getting people into the mindset that, age does not have to mean pain and weakness. It does not have to mean that you have to sit inside and not travel, not do all of these things. So
I love it. It's awesome.
I know you're encouraging people to like take control of their health, right? It's not sick care, it's health care.
Exactly.
It's an investment, like straight up. I guarantee
it is.
Prices are not like a copay, but when they do the math, it actually is less money for the duration, and they'll stay healthier longer, right? That's
exactly. It's a long-term investment, and I feel like that's unfortunately not the mainstream. So, I mean, having to convince people of that, can be kind of difficult. But once we can kind of start, and I do think it is turning around. I mean, I do think that some people are shifting towards that mindset. I've met a lot of like masters power lifters, masters CrossFitters, all of these people doing such great things, no matter what age they are. And so I actually wrote a book to kind of help motivate people. And so Move Well, Age Well is what it's called. And I can send you guys both, a copy. It's just like 40-ish pages, but I mean, it's more of the motivating and empowering. Like, look at all of these people doing crazy things, at 60, 70, 80, your life doesn't have to be over at that point. So that's been kind of cool too. I've gotten some good feedback on that.
That is awesome. Oh my God.
I mean, just pushing content. I mean, I just feel like that's what my main goal is right now. And then eventually monetize and things, but yeah.
Oh my God, that's super cool. So
I love it. I can't even get over it. That is so cool.
So anything else? So while we kind of like wrap things up, so anything else that you think that you want to share with either one, the consumer, or two, a clinician who's thinking of going cash, but they have not pulled the trigger, like what would you say?
Be passionate about something before you take the leap, because I can tell you one thing, this is not easy. So, and I feel like a lot of the times people are, pushing out all this stuff on Facebook and things like, oh, make 6 figures in your first month and all this stuff, when it really doesn't look like that. And, it's a lot of work. And I think sometimes that gets skewed a little bit. But I mean, it is so worth it, even from, the couple of patients I've had and things, and just getting kind of started. I mean, having that freedom, I think, is so worth it. You just have to be in the right mindset, because I have, thought about giving up 1,000 times already, because I mean, it's just the nature of being, and I'm sure you guys probably have been in the same boat. Like, what am I doing? Can I actually make it happen?
Apparently, yeah.
Yeah, right. And so it's like, I mean, so you like really have to be in it to, continue, keep moving forward, and you'll meet that one person that's going to have all of these leads and things. So definitely, I think just being passionate about it, making sure that you are there before you take the leap. And the consumer, I mean, age does not matter. I mean, you can do so much, but you just have to put in the work. I mean, it's not going to be, you know, wave a magic wand. It is going to be work, but I mean, it is going to be so worth it. I mean, you're 90 years old sitting in your home without any need for help or anything, but you can't wait until you're 89 to start doing that. You have to start working now. So, I mean, that's just the biggest thing, is don't discourage people from, you know, doing what they like. If they have a goal of, you know, running a 10K at 70, I mean, there's ways around it. And don't discourage people from their goals just because of their age, but also don't look at someone that is older and think immediately they need light weights, they need, you know, lots of rest. I mean, it depends on the person. And I mean, you just can't take the easy way out.
Love that.
I love it. That's great.
So
Thank you. This has been great.
Thank you.
yes, absolutely. This has been, I love talking about this. And I mean, definitely, like I said, if once you're passionate about it, I mean, I talk about my business 10 times a day to 10 different people. And so, I mean, you have to be willing to, you know, take that leap. And I'm sure you guys have done the same. I mean, so
Totally.
it's hard work, but it's worth it.
It is.
And for people who want to find you, Instagram, you are at Adventure Alive.
Yep.
For your website, keeptheadventurealive.com.
Mm-hmm.
Great. You also have YouTube, and we're searching Keep the Adventure Alive.
Yes. So if you just search Keep the Adventure Alive, some videos should come up. And then if you subscribe to that too, that would be lovely.
We will definitely do it today. How about your book? If someone wants your book, how do they get their hands on it?
Just search Move Well, Age Well book, and it should come up on Amazon. So it's only on Amazon.
On Amazon.
Yes. And I just uploaded the new, so I published this a while ago when I was still Move Well, Age Well. So I just published yesterday, or republished an updated copy. So the links in the Move Well, Age Well book will not work. They are now Keep the Adventure Alive. So, but it's still the same title and everything. It just, the inside changed a little bit.
Cool. So we will make sure to get all of that shared in the comments when we share this.
Yes.
You'll share this on all your platforms. We'll share this on our platforms. And
yes.
We look forward to seeing everything that you do.
Yes. Thank you so much for this opportunity, guys. I'm sure you guys are doing great things too. So